Welcome again to the Australian ORCID Consortium community call. This is the second one we're doing this year. And if you haven't attended a community call before, well, I should say you're in for a surprise. It's pretty intense. It's lots to do, plenty to get on with, but just ignore all of that. I was joking. It is pretty laid back and chilled. What we generally do is a lot of interesting things, I would say. But let me also mention that along with myself, Brian from ORCID will also be giving us a quick update. But for those of you that don't know me, my name is Melroy, and one of the things I do is look after the Australian ORCID Consortium at the AEF. Now, before we get started, I'm going to just take a bit of time to acknowledge the traditional owners of the country where we gathered today to exchange and share knowledge. I'd like to acknowledge the traditional owners, the Yagara and Turrbal people of Myanj, and pay my respect to their elders past, present, and extend that respect to other Aboriginal and Torres Strait Islanders people today. Now, this is our agenda for today. It is fairly light. I'm going to make introductions first because we've got some new staff that we should be meeting. Then a quick update on what's happening within the Australian ORCID Consortium. As I mentioned before, Brian's also here with us. Brian's from ORCID and will give us a quick update. And then we have the Q&A. Then we'll have a Q&A session. And open the floor to anyone who would like to talk about success stories. Do you have any blockers with regards to ORCID, questions regarding ORCIDs, or even PIDs in general? So starting off, recently we've had Julie Toohey join us as the ORCID community specialist, and she comes to us with a wide variety of experience in a number of research supporting roles. And before I let Julie give us a quick introduction about herself, I would also like to give a big shout out to Emily and Kerry from the AAF comms team, who help us deliver these community calls, webinars, and other ORCID related communication. And I'd also like to give a big shout out to Elena, who is our COO of the AAF. And she's got the overall responsibility for the consortium. So she makes sure that we're doing everything we can to make sure all our consortium members are getting the right sort of advice and service and everything else that is included. Now, Julie and the others will be monitoring the chat window. So if you have any questions as they arise, please type them in the chat box. And once the presentation is over, we shall start answering them in order of arrival. So now I shall hand it over to Julie to give a quick introduction about herself. Julie?
Thank you, Melroy. Must say how excited I am to be working with AAF and in the ORCID community specialist role. A little bit of background on me. So for over 20 years, I've been working within the academic environment, primarily around research, but also to learning and teaching as well. Spent most of that time supporting them in mainly engagement and advocacy type roles. So I would speak to them about open access, open science, FAIR principles. Also to would include best practices around research data management. And in those roles too, I have also provided advice to the community members around publishing strategies, research and metrics, and the importance also to of researcher profiles and also to their profile IDs. So very excited to be here. And I just want to quickly let you all know that I'm really looking forward to working and supporting the ORCID community in future webinars and events like this. So thank you, Melroy.
Fantastic. Thanks for that, Julie. And so people, if you see an email coming in from Julie, know that it is not a spam and that she is genuinely trying to reach out to you to find out more information or to inform you about stuff that is happening. Now, moving on. If this is your first community call or one you've attended after a long time, here's a bit of information about the Australian ORCID Consortium. Now, the consortium, the Australian ORCID Consortium itself, is a not-for-profit entity. It is generally run on a cost recovery basis, and that the consortium is managed by the Australian Access Federation, or more popularly known as the AAF. The AAF provides identity and access management services for the higher education and research sector in Australia. Effectively, if you've signed into a number of research resources using your institutional username and password, the underlying infrastructure that makes it possible is what the AAF does and is what it provides. Moving on. So with the consortium, this is one of the pictures of the consortium. It shows you all our members that are spread out across Australia. The consortium itself has currently 44 members, of which 38 are universities. We've got two national funders, the Australian Research Council and the National Health and Medical Research Council. Then there are three other research organizations that are also the part of consortium. So that's CSIRO. Then there is ARDC, or the Australian Research Data Commons, and ANSTO, which is the Australian Nuclear Science Technology Organization. And we do have a government organization that joined the consortium back in 2022, and that is Queensland Health. So why exactly do we have a consortium, you ask? It's pretty simple. The consortium itself is a community of like-minded organizations. And what it does is it allows us to help create a national community of practice among like-minded organizations and people where everyone can participate and contribute. It lowers the barriers to entry. It provides premium market membership to all consortium members and reduces that cost by over 50%. And since 2016, that is when the consortium first launched, it has saved members over $5.9 million in just membership costs. One of the things of having a consortium means that there is in-country tier 1 support available, which is what we provide from the AAF as the consortium lead. So what exactly is our ORCID community up to in Australia? Here are some current statistics. Between the consortium members itself, there are 42 active integrations, and these integrations have connected around 187,000 ORCID IDs between their systems and the ORCID registry. Now, these integrations are a healthy mix of both bespoke or custom integrations and vendor-based integrations. Now, among the vendors, we do have a number of users using Symplectic, they're using Pure. There are some that use Open Journal System. Then we've got DSpace, Esploro. If you're using Haplo or Cayuse, we've got institutions using those vendors too. Now, these integrations have also added approximately 1.4 million works into ORCID records and the registry itself. Now, this is quite good because what that means is all these records that have been added, all this data that has been added into ORCID records, it's coming from a source of truth where members do spend a lot of time collecting and curating this data, and then being able to add it into ORCID records just means that the wider research sector can then get access to it. It improves data quality, improves research reporting, reduces burden, and all the other fun stuff that happens. Now, there are 212,000 ORCID records with a .au email domain. And what that means is it indicates 212,000 researchers, or approximately that many, have entered in an email address that has an Australian domain or ends in a .au email address. Now, this is all information that I can get from the ORCID reporting dashboard for consortium leads. If you are wondering, is it possible to get similar sort of information or statistics for your institution? If you're an ORCID member, the answer is yes. So, how do you do it? Well, you will need to log into the ORCID member portal and look at the member reports. But if you're not sure how to access it or you have any questions, just send us an email to support@aaf.edu.au letting us know. And you'll find that either Julie or myself or one of the team will get in touch to book a meeting at a convenient date and time for you. However, it is not always just about reporting dashboards and member portals that we want you to contact us. I mean, if you even just want to talk about your ORCID integration, any sort of communication strategies with how you'd like to do your ORCID or roll out your ORCID integrations, we are more than happy to have that chat with you. So just send us an email to support@aaf.edu.au and we will get in touch. So, what are our plans for 2025, you ask? Well, there are too many to talk about in this one session. I mean, let's face it, there's not enough time. So I'll just give you the ones that I think are really, really, really important, right? First of all, we'd like to continue to provide consortium members with a wider range of communication and outreach activities. And that would mean sessions like community calls, webinars, bunch of other collaterals that they can then use. Second thing we'd like to see is we'd like to see ORCID integration activity by members increased within the consortium. And this is also helpful, especially if organizations are looking at the national PID strategy and roadmap and how to move along there. So it would help them also meeting some of those goals and requirements. And then we would also want to continue to provide our members face-to-face services or one-on-one discussions as and when required. And now what I'm going to do is pass on the proverbial talking stick over to Brian, who will give us a few updates on what the great folks at ORCID are up to. Remember, if you have any questions at all, please put them in the chat window and we can answer them once Brian is done with his presentation. Or you can even ask them after Brian is done with his presentation and we can answer them. So you can ask it orally or you could put it in the chat window, whatever takes your fancy. And so I'll stop sharing and Brian, it's over to you.
Yeah, thanks, Melroy. Hi, everyone. Very happy to join you and greetings. My name's Brian Minihan. I'm the engagement lead for the Australian Consortia. I am located in Hawaii. I was previously in Hong Kong. So just know that there is a ORCID person more or less on your time zone, except for Monday, right? Because it's Sunday for me in Hawaii. In any case, very pleased to join this community call. I am going to share a few slides from a recent webinar that we had. We have quite a few of these, just kind of talking about topical ORCID issues. But I thought it might be good, and Melroy specifically asked if I could talk a bit about our certified service provider arrangement. And forgive me if I just do a bit of background, because I myself, before I joined ORCID, I was a librarian. So this is a kind of a challenging, it was a challenging concept for me. Typically a lot of folks that are librarians, they're used to dealing with vendors. You buy this product, maybe there's some content there. When unis or other organizations join with ORCID, you need a mechanism to connect with ORCID, because ORCID is just really just a registry of persistent identifiers for a person, and then hopefully persistent identifiers for all that that person has done. So the works, the organization they work with, the funding they've got, blah, 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 all down the line. But you can't do anything with ORCID unless you have a third-party system. So many organizations sit there and they think, well, what should we use to connect with ORCID? Well, if you're a uni, maybe a CRIS system, which Elements is quite popular in Australia, and there's a few pure instances. But if you're a publisher or a funding agency, that might not be the best thing. So in our very, very brief history at ORCID, we've realized that the third-party system connection with ORCID is the biggest hurdle and biggest challenge that most organizations will encounter. However, once they do it, the rewards are quite high, and I know that Australia has a few bits of information ready to share on how that saves money and also researchers' time. So this is the whole point of this certified service provider program. I'm going to share my screen here. And really, my colleague Shivandra Naidu is really kind of the person heading this up. But I just thought I'd share some recent updates with you guys if you're interested. Having said that, I also have to say, because Australia is such an advanced ORCID entity, all 44 of you guys have a client ID, which is fantastic. And I have to point out that compared globally, that's an amazing result. Also, I just have to say, I was fishing around, and Australia member organizations have added almost 6,000 affiliations this year. That's also a grand result. A lot of countries around the world struggle to kind of go through that process of the API, adding that trusted affiliation to the researchers' record. So I'd say kudos to you guys. Just before I switch over. Okay, pardon me, I don't have my glasses on, so I'm doing this a bit squinty. Right, all right. As I said, this is really a summary of my colleague Shiv Naidu's webinar I think about 2 weeks ago, and I'll share the full link to that webinar because I think it'll be much more detailed on things. Again, just summarizing, this is what ORCID does. We do the persistent identifier for a person, we give the record, and then we offer the API service. The API service is what gives researchers in Australia the massive benefit, as opposed to, say, researchers in India or China, where there's only a few member organizations. And essentially, it just saves the researchers time. So because ARC has an integration, because NHMRC has an integration, Australian researchers have a lot more trusted information in their ORCID records, thanks to that membership that, say, researchers in China and India do not have, just by accident of non-membership in those geographic areas, right? Have a look at this if you want to, familiarize your community with what happens with a ORCID record. and why that might be useful for the researcher. Because at the end of the day, the main thing is to save them time. Filling out paperwork for grants, for publications, for tenure, for to put anything in the repository is less time that they have for research. Just gonna put this here. I remember when I started at ORCID, and Melroy, you've been at AAF longer, but I do remember when we were like half of these number of organizational institutes. It was like about 900 or so. So that's quite a big growth. And again, people in just about every country have an ORCID ID. So that's quite a bit of coverage. Right. As I explained, we're trying to, as ORCID is kind of trying to simplify the thing for the researcher, we're also trying to simplify for the member institutions who support us through annual dues and the member API. Yeah, we've got these pain points essentially, and this is why ORCID was essentially started of, submitting a grant application, submitting a manuscript, telling your uni what you've been up to, and giving that info over to the CRIS system so that they can assess your research value. And then last but not least, maybe putting some information attached to that research in a repository, be that data or publication. When I talk to folks who are interested in ORCID, I always highlight the things that you can't really get from, say, Scopus or a sort of profile system. The peer review bit, right? Most researchers will do a lot of peer review, and that's not necessarily going to show up in Web of Science. It's not going to show up in Scopus. But if your journal or publisher that you're doing this peer review on behalf of is a ORCID member, then they will put that into your ORCID record. And I think that's a really important aspect of research that gets overlooked. We do a lot of voluntary service as researchers that often doesn't get covered in, say, an H index or the typical metrics, and funding information as well. That's not in other kind of for-profit sources of information. Right, so you've got all this in your ORCID record. We do have a way of kind of noting provenance. So, it is possible to just add education, employment, works, you name it, all by yourself. But that's going to look a bit different from these, which come from external sources, which adds a bit of trust and integrity. And that is for a number of research activities. Okay. To the kind of certification bit, we really just want to streamline the process. We want to make sure that the things that make data integrity in ORCID is held up by this process. Let's not forget, ORCID is maybe about 12 years old. All that data came from either the researcher or from a member entity adding it via API. And, if that data is no good, then, we look bad, the researcher is upset, the member institution doesn't look good. So really the integrity of data is very, very important to us. And so this is why we place so much importance onto certification. And, at this point, I am going to was. No, I'm sorry. I'll wait until the end of the presentation. But I will put in a link to the full slides, because this is kind of a condensed edition for this Australian audience. More or less, what we're going to do is, starting November 1st, we're going to rethink the way that all systems are certified. So if a system is not certified, so that could be like CSIRO, they have, they're an unusual organization, so they created their own systems. We've reviewed those. They meet our best practices. They're fine. They don't need to do anything. So this really only impacts, I would say, a new member or an institution that wants to change systems. And so, we would kind of, along with AAF, would have to have a look and make sure that meets our best practices. Okay. Again, like I said, it's a bit of a hard thing, because we're trying to be the hub for many different institutions. So that could be manuscript submissions for publishers, Chris's, and even discovery systems. And I would say we've been doing, I don't know, Melroy, I think I've been certifying things with you for 5-6 years. And so it's not, if you're not certified, don't worry, you'll have somebody kind of ask you for some details, and it should be pretty simplistic and things going forward. So just one last thing, that certification is for 12 months, and then we'll revisit it after a year. That doesn't mean that the credentials or access to ORCID will be taken away by any stretch of the imagination. Okay, so you can do this request. We'll do the assessment, issue a decision, and that's kind of how the process goes. Here's a very detailed look at, I don't think we may have any publishers in the audience. This one may be of more use to the unis who use Chris systems. Of course, grant agency criteria here. So essentially, we've come up with kind of standard, but then a teeny little bit of tweaking for the different systems going forward. And if you use a discovery system. Okay. Just to let you know, these are the current ones that are certified. I know a lot of Oz folks use Elements. I think there's this Esploro instance or two. And yeah, and again, these guys will have to be assessed at the end of 12 months. All right. Oh, goodness. We also did a survey. I'm just going to fly through these. I hope that's all right. So we kind of wanted to ask what would the motivation for a vendor be to do this? So as you can see, the transparency is quite important. Sorry, I'm going to do this. Some of you may or may not know your neighbor, New Zealand, has a national kind of system, the NZ ORCID Hub, which has been certified, and they've, readily participated in that certification process. It's an interesting system. In fact, our affiliation manager is largely based on the technology that it does, but only for employment education and things. But Royal Society, Te Aparangi also add everything else from funding to works and things like that. So something to bear in mind if anyone is wanting to create their own system. All right. That is Shiv's contact. You're also more than welcome to contact me. And I will now pop in my contact and where you can find the full presentation of this service provider certification latest instance from ORCID. And
Thank you for that. Thank you for that, Brian.
sure. Yeah.
I had a question, so I'll just jump in before anybody else gets to ask it. With the certified service provider, now we know that within the Australian ORCID Consortium, we've got a number of members that are using Symplectic, Esploro, Quse, and all of those. If they've already been certified and they're already using those systems, they don't need to go through the whole recertification process themselves, right? It is just the vendors that do it, and that will happen in the background, and then the systems get updated and all of that sort of jazz, and the members don't have to do anything, correct?
Yeah, that's an excellent point. So if you have a working integration, whether it's certified or not, this will not impact you if you're continuing on with your current system. It's really only for people that want to do a new integration. So if I'm not mistaken, let's say, is it Western Australia? I think I have a pure instance, or maybe not.
Yeah.
In any case, they're not certified. They never were. So this doesn't impact you. Anyone with an Elements integration, let's say Elements is not certified, it doesn't matter. You continue to use your integration. So it's really only for new issuing of credentials. Yeah.
Right. So the existing credentials are not impacted, and if you've got an existing working integration, that is not impacted, but it will impact you if you decide to change systems and reuse a new integration.
Yeah, and again, I mean, it might be a few extra hoops of documentation and things, but generally these systems, we know how they operate, and there may be like one or two things, like very nitpicky things that we'll just want to document before issuing a new credential, essentially. So
cool.
Anything that's existing keeps going, and that's that. Yeah.
Beautiful. Does anyone have any other questions for Brian or for us at the AAF? Anything at all? Doesn't necessarily need to be about your integration, Any questions about PIDs or the community call or anything else? That's the point of having this community call, is we get to exchange ideas, talk about things that are happening, and if there's anything we could do to help, or if somebody's come across a solution that they think would be useful to the others within the community, this is your chance to speak and share that knowledge.
Could you, at the risk of being repetitive, I think I always ask this question, what's next for the national PID strategy? If you
that is well, it is not there is the strategy out, and we have the roadmap to the national PID strategy, and currently we have stakeholder action groups for each of the different stakeholders within the research community itself. Initially, I think the thought was having one stakeholder action group, but it is just difficult to try and do various as in with different stakeholders, they all have different requirements and different motivations. So we've split it into research organizations as a stakeholder action group. Then there is a funder stakeholder action group, and that has your main funding body. So there's the ARC in that, the NHMRC. There are a couple of other funders in there. Then we also have the NCRIS stakeholder action group. Now, for those who are uninitiated about NCRIS, that stands for the National Collaborative Research Infrastructure Strategy. And these are services like your Australian National Fabrication Facility, the ARDC, the AAF. You have NIST, which is National Institute of or National Imaging Facility. Sorry, there's no institute in there. National Imaging Facility. There's Microscopy Australia. So all of these are NCRIS services, and they provide services to the research sector in terms of computing power, in terms of facilities, resources that researchers use. So it is quite important to also get an idea with what their requirements are. And the national pitch strategy is not something I guess we want to say and tell people this is what you have to do. No, it is something which is collaborative, and we would like input of all our stakeholders into it to let us know that, well, how can we get to this level of aspiration which is outlined in the strategy? And the roadmap is what will help us get there, but it is only possible as a community effort. So it is only when we all contribute and work with each other to understand what the blockers are, what successes look like, that sort of stuff that'll help. Does that answer your question?
Yeah, indeed. Yeah, I just want to say that I also have to, I think my role as the international person here, I also have to say that Australia is really quite a leader in this instance as in others. So well done, Oz, and a lot of other countries that are kind of considering these steps kind of look to Australia for how to go. Yeah.
Oh, any other questions? Surely you'll have some questions for Julian. Like, she's sitting over there, she's just waiting for somebody to ask her questions, and nobody's doing that. She's feeling quite disappointed now.
I have a question.
Oh, yes.
At Macquarie University, we have quite a high uptake of ORCID because we've pushed it really, really hard for a number of years now. I guess a challenge we have, being perhaps a bit more mature in our implementation, is if there are any approaches anyone has for encouraging researchers that have everything set to private. Because I suppose trusted systems might still benefit from the data that we're pushing, in our case, from Pure. But I guess to anyone looking at that record, it just appears empty. And I guess there's not much benefit in that sense. But I suppose they could still grant permissions to trusted systems such as the ARC RMS. But just wondering if anyone has any ideas about encouraging opening up ORCID records, or how to approach that conversation.
There are a number of ways I would look at approaching it if I were at the university. So first is part of my comm strategy would be letting the researchers know that when they first sign in or register for an ORCID ID, they get to set what the overall privacy level of their ORCID is going to be like. Is it going to be public? Is it going to be read limited? Is it going to be private? Now, sometimes researchers by default, because they're afraid everybody else will find out about that information, they set it to private. And that could be because they're not exactly sure what the different things mean. We always suggest, and we talk to, whenever I talk to researchers, I tell them that, look, if you're setting up an ORCID record, you want to make that profile of yours, the record of yours, public. Reason being, everybody can read it, everybody can look at it, they can see the excellent work you're doing. And from there on, you get the sort of credit you should be getting. However, if they still are quite cautious and they still want to maintain a level of control, they can go ahead and make it read limited. Now, what that means is only those systems that have explicitly asked for permission. So your standard API systems, your search and link API wizards, those are the ones that can read information. And that is the overall level. But then there is a third thing they can also do is if they are still more cautious, they can individually go to each record and they can choose to make that record private, read limited, or public. Now, what we've realized is that some researchers within their ORCID record, they have duplicates of a number of works that they have. For example, Crossref might put in a journal article. Their university's research repository might push the same journal article into their ORCID record, and they would have manually added that journal article into their ORCID record. So what ORCID does is, because it recognizes the DOI in all these three cases is the exact same thing, it will just group it together and it will show all three. Now, if the researcher has set their record to private, all three of them will be private. If they've set their record to public, it will take whatever privacy level their record has. But they can manually go in and each work, they can switch it off to being read limited, private, or public. And what we encourage them to do is, if you want to keep the stuff that you have written private, you can go ahead and set that privacy level to private. But the other stuff that organizations have written or Crossref has written, or that's coming from an API, you want to at least set it to read limited at the minimum. It would be great if they could do it public, but minimum. But ideally, it would be the way that's being communicated to the researchers and how to get them to do that. But more importantly, it is also showing them the benefits, because what we've seen in the past, or what I've seen in the past, was when the ARC first time announced that they were going to use ORCID with the RMS system, a number of researchers, when they first started applying, said they had issues populating their information into the RMS system because it wasn't automatically picking it from the ORCID record. Further investigation led to the fact that their profile was almost entirely private. So literally the system couldn't read from it, which kind of negates the point of actually helping reduce the administrative burden. So it is bringing things like this to their attention, saying, at the very least, if you make it read limited, it means that only those you've given permission to are able to read it. And if even then they are not happy with it, they can always go into the ORCID record and revoke that permission. So there is always that facility. At the end of the day, they are in control of their ORCID record. And I think that is something that tends to give them that little bit of, I think, ease of mind that, well, if we can do that, then that's fine. But I guess that's one of those ways we could look at approaching it, is letting them know you do it public in the first instance. If you still can't do it public, you want to make it read limited at the very least.
Yeah, I suppose it's just an education thing.
Exactly.
But are there any ways that we can be alerted to the fact that they've set everything to public? Like, I know there's an ORCID dashboard that you provide, I think. I don't have access to it, but my manager does. Is there anything in there to say which users have made their ORCID private, or will I just have to write some code to look up the ORCID APIs for all of our ORCID users to see whether they've exposed anything to the public? Just so we know who to contact.
Yeah.
Try and educate.
Yeah, good question. There is essentially, if they appear in the dashboard, then that means they've either done trusted parties or public. They, as Melroy mentioned, private is not going to work. But it's an interesting idea to pass on the, for my product colleagues of displaying, either public or trusted parties. That might be an interesting insight for you guys at Macari and others. I'm also thinking it might be interesting to do like an ORCID webinar about the trusted parties status and how to do it and what it means. Because this question comes up quite a lot, especially for unis trying to track, and obviously like come up against a wall sometimes of visibility. And oftentimes, as I think Melroy rightly states, it's just kind of nobody knows what, people are busy. They just, click buttons and there you go. You're off, and a year or two later, you don't know what you've done. But that might be an interesting topic for us to cover about what, that yellow middle level trusted part, because why would you even have an ORCID record if you didn't want your, publications or your uni to be able to see it? It doesn't make any sense. Trust me, I have seen it many times. There are people that have they've got like 200 publications. They're all set to private, and the unis contact us and they're like, well, I don't understand what's going on. And I have to say, this person does not want they're not giving the permission over. That's the issue. It's nothing. You're not doing anything wrong. We're not. It's that individual control is paramount. And if the individual doesn't know how to, or is making a mistake or a misconception, then that's that. Yeah. So it is kind of, as you say, a bit of education.
Well, we were only actually alerted to this happening from, we saw a dimensions dashboard that on ORCID that was indicating there are actually quite a few people without ORCIDs, and we're like, hey, actually, we know that we've got good uptake because we've got our own internal reports, and we can see in Pure they've got their ORCID there and it's authorized. But to the public, it doesn't exist because they can't actually identify that ORCID is for that person. All they've got is a name. So,
there's a few aspects. Sorry, just one more thing. I know that, for instance, like the US government has some researchers that definitely want their outputs private because of security concerns and things. I can tell you as a former resident of Hong Kong, I understand that, and so there are, absolute good reasons to have not everything in your research set to public, but trusted parties might be good, right? You might have something that you did, but you don't want everyone to see. And the other thing too is that's the, I hate to veer into like salesmanship, but like this is our a lot of what we say when people look at, say, the public data file that we put out every year in October for Open Access Week. That's just the information that all the researchers globally want public. So it's a snapshot, but it's not completely accurate because, as you mentioned, there's quite a few people that have a lot of things set to trusted parties and quite a lot of information that is set to private. So, yeah. Sorry, Melroy, go ahead. Yeah.
No, I was just going to mention that one of the other things that you could do, Rhiannon, with the thing is you already know the ORCID IDs that are there in your Pure system. You know the ORCID IDs that are coming through from the reporting dashboard. So the affiliation report actually tells you how many publicly available ORCID IDs are there. So between the publicly available ORCID IDs and the stuff that you have in your Pure system, you'll know exactly how much of that is visible and which researchers, if they are not publicly appearing in the if their records are not public, it means they're either read limited or private. And then those are the researchers that you can contact and say, look, we understand you've made your entire record private or read limited. Is there a particular reason? Is there something you're not sure about, you would like someone to speak to you about? And that way you can then address it, but it would effectively be cross-referencing that public list that is there in the affiliation report with what you have in your peer to try and look at which ones aren't appearing. And if they aren't appearing, it's probably because they aren't public. And so then we can start narrowing it down and finding out exactly who needs to be contacted. If there needs to be education, you might realize that there might be an entire cohort. For example, there might be, I'm not picking out any school, but say, for example, there might be School of X, where most of the researchers have made it private, and it's probably because nobody's told them that they shouldn't be doing it, or nobody's told them the benefit of making it public or read limited. So that's another sort of thing that you can find out and then work towards the whole.
Okay, great. I'm glad to know that there is something already set up that I could use to cross match. Would I be able to get access to that dashboard as well, or should I just get my manager to get the data? Because he's already got access.
You should be able to get access to it. So your manager would be able to
that contact email that you mentioned before. Yeah. Okay.
So just send us an email. We'll find out how to get you access, and we can go from there. Shouldn't be an issue.
Great. Thanks so much.
Brian, I'm mindful of time. There's only 3 minutes left to the call, if you like. But I'm just thinking, do you know of any particular comms or documentations or resources that might be on the ORCID website that might be able to talk more about the benefits from Rhiannon's question, the benefits of making your record open?
Yeah.
Is it not yet available?
No, there is. It's just a matter of
well hidden.
It's a matter of peeling the layers.
I think Melroy knows it's like even at ORCID we have to Google it. So I'm just gonna put this in there.
Share that.
Yeah. But I do think honestly, I do think it's a good idea to focus a whole
webinar on it.
Event on it, because it's just it doesn't go away. And and I understand people are busy. They don't have time to read through all the blah, blah, blah. And so,
Cool. We can put it on our list and we can look at doing something like this.
Yeah.
Next year, and we can do it for researchers in general. So if ORCID would like to collaborate and do something, we could do something for researchers in general, and it could be a resource then everybody could use, and it doesn't even have to be that long.
No, and indeed, Rhiannon, I mean, like in Asia, I think it's a especially big deal because north of you guys, like up, in East Asia, a lot of researchers, they just want like some staff person to do all this for them. And this is the case where they have to know this stuff, who can access and who's is visible and things. So definitely a good topic.
Cool. And with that, we are at the hour. So I would like to thank you all once again for taking time from your busy schedules to attend this community call. As always, it's a pleasure. See you folks, have a chat with you, find out what's on your agenda with regards to ORCID or PIDs. And thank you, Brian, for that excellent presentation, as well as for all your suggestions on things to do. And yes, do keep in touch. We shall see you at our next community call. But in the meantime, if you have any questions at all, please send them to support@aaf.edu.au. Most probably you'll find Julie's answering all your questions. Don't worry, she knows everything. So yeah. Although I might jump in and answer a few of them. All right then. Thank you everyone and see you all.
Thank you.
Thank you.
Bye, everybody.
Bye.
Bye, everyone.
Thanks, Brian.
Thank you, everyone.